Hi, my name is Carlos Samaniego with Healthcare Tax Advisors. Are you turning 65? I've got some free advice I'd like to give you in regards to turning 65 and being brand new to Medicare. You see, when you turn 65, that is the time that you are eligible to enroll in Medicare. Normally, that time frame is considered your Medicare initial enrollment, which is about 7 months long. It's the 3 months before you turn 65, the month you turn 65, and then 3 months after you turn 65. That is an important time frame to you remember, and don't let that time frame pass. That is the time frame that you are allowed, that you are eligible to enroll into Medicare. So that's tip number one. Tip number two is that you can delay enrollment in Medicare Part B. You see, most people get Part A, which is the hospital insurance of Medicare, premium free because they or their spouse have worked their entire lifetime and they've paid taxes. So there is no cost for Part A, so it makes sense to enroll in Part B. However, Medicare Part B, the medical insurance of Medicare, has a monthly premium to it. Now, you may want to delay signing up for Medicare Part B if you have other healthcare coverage, such as it covers through your employer or through your union. I know when my mom, Angie, who's right here in this picture, when she turned 64, she was, 65 and eligible to enroll in Medicare. She actually did not have to enroll in Medicare Part B because she was still working at the VA hospital in Loma Linda. So there was no need for her to enroll in Part B. However, people do not know that, and sometimes they will enroll in Part B even though they have health care coverage with their employer, and now they have an additional cost that they shouldn't have. So again, remember, tip number two was you can delay enrollment in Medicare Part B. If you have questions about that, that's something that we can help you with. Now, the third tip I'd like you to remember is there's two ways to get Medicare. Medicare gives you two ways to get their benefits. There's original Medicare, which is Part A and Part B, which is the traditional way. There is also what's called Medicare Advantage plans, Part C, which is an alternative to original Medicare. You see, original Medicare is actually administered by the federal government. Medicare Advantage plans are actually offered by private insurance companies that are approved by Medicare. Now, they must provide all the same benefits as original Medicare's Part A and Part B, but many of those plans have some additional benefits, such as prescription drug coverage that's included with their plans and other benefits. I can give you more details if that's something that you'd like in regards to the additional benefits that you may get with those plans. Now, tip number four is Medicare does not cover everything. This is one of those few things that gets a lot of catches people by surprise. They think that Medicare, once they get Medicare, it covers everything. Now, original Medicare does not include prescription drugs. You can buy an additional, what's called a standalone prescription drug plan to get this coverage. Some people also buy a Medicare supplement plan, or what's called a Medigap plan, to help them with some of the costs not paid by original Medicare. Now, generally, you don't need to buy any additional coverage if you choose a Medicare Advantage plan. So again, here we talked about Medicare does not include prescription drug plans. So if you go with the original Medicare, you're going to have to buy a prescription drug plan. Now, there's a lot of tricks, I shouldn't say tricks, but strategies in regards to you should know what medicines you're taking and what the costs are, because there are a wide amount of there's a lot of insurance companies that offer prescription drug plans, and everything could be a little bit different. The other part about this, again, as Medicare doesn't cover everything, is Medicare supplement insurance plans are available to you, and there's also what's called Medicare Advantage plans. Now, the last and final tip I want to give you is that you may qualify to get additional help with your Medicare costs. There are several programs that offer financial assistance with Medicare premiums and other costs. Now, you may want to look into them because you may be eligible and not realize it. Give you a perfect example. My mom was on Medicare for almost 4 years paying the full cost for her prescription drug plans and did not realize that she was actually eligible for assistance for her prescription drugs. Literally, she was paying over $90 a month for her prescription drugs, and the cost of those, once we got the financial assistance that's available to her, dropped down to less than $10 a month. So these are things that you might want to look into. Now, again, my name's Carlos Samaniego. I'm a Medicare insurance agent. I help people at no cost look at all their different options that are available with Medicare. I assist you with looking at what's available with Medicare supplement plans, because there's a variety of Medicare supplement plans that are available and different costs associated. There's Medicare Advantage plans, and I also assist people with looking at their prescription drug plans by actually looking up their medicines and giving them the actual cost. And finally, I helped make sure that they qualify for any financial assistance if they may qualify for it. Now, if this information was great, please don't let Medicare sneak up on you. Use these 5 tips I just gave you to get you that head start in learning about the basics of Medicare. If you'd like to get a free special report that I have available to you, just click the link below. I will send that special report to you and give you the opportunity, if you would like, to sign up for a free no cost, never charge consultation. We can do it right here in my office, which is located in Redlands, or I'd be more than happy to come to your home if you're unable to come to the office and sit down and do a full consultation and give you everything that's available to you. I hope that helps, and happy birthday, and I wish you the best. Take care for now. Bye-bye.